Well, good afternoon, everyone. Phil Penarski here with CBS 42 Now. We are just a few moments away from hearing from Alabama State Health Officer Dr. Scott Harris as he gives another COVID-19 update regarding mitigation efforts and the latest numbers in the state. It appears he has already appeared to the podium, so we will take you there live now.
For you all to ask questions or for us to give you whatever information we can. Alabama's pandemic of unvaccinated people continues. We have not had a particularly good week. We have seen increases in our hospitalizations again. As you know, our state has a net negative capacity of ICU beds at this time, which is extremely problematic. We are seeing case numbers that are continuing to climb. Among those that we have data on, certainly the hospitalizations and deaths, we know that most of those people are unvaccinated. Certainly among deaths, virtually all of them are unvaccinated people. And so we continue to encourage people to please get vaccinated as quickly as possible. Vaccination is the best tool that we have for ending this pandemic and getting us back to normal. We continue to encourage people to wear masks when they're going to be in indoor public spaces. We continue to encourage universal masking in our schools. It's very, very important for our schools to understand the need to send home cases of COVID, and those who are close contacts to COVID, those individuals don't need to be in the classroom because they put other children at risk. We want to make sure our kids are able to remain in school for in-person education. That's vitally important to them, and the best way we know to do that is to make sure that kids are wearing masks consistently, that kids who are eligible for vaccination are getting vaccinated, and that kids who are identified as cases or close contacts are sent out of the classroom setting. I want to review some numbers for you just to give you a sense of where we are. 1 month ago, yesterday, we had a total of 500 inpatients in Alabama hospitals with COVID-19. That was on July 19th. Yesterday, on August 19th, we had 2,764 people in the hospital with almost 100 more who were suspected of COVID and were awaiting additional testing. That number from yesterday includes 50 pediatric patients. The number I saw yesterday is that 9 of them were ventilator patients here in our state. These are the highest numbers that we have seen for pediatric admissions since the pandemic has begun. As I mentioned to you, we have a negative net negative capacity for ICU beds. We have more people assigned to ICU beds than there are physically beds. And of course, the way that happens is that hospitals are forced to have makeshift space for these patients where they take a regular room, a hospital room that's not an ICU room, and convert it into that, or they leave patients in the emergency department, or they create space for patients in a hallway or some other non-clinical space. That is a little bit regionalized in a way. That is to say that we are still seeing the crush of these patients in the southern parts of the state, although we have very high numbers in some other parts as well. There are some beds that are literally available in some parts of the state, although really almost single-digit numbers. They're virtually none. But because of the huge crush of patients in southern Alabama, is how we come up with that net negative capacity overall. COVID deaths continued to climb. We have a delay in reporting deaths officially because there's a whole death certificate process, and we normally allow for about a month to get that data submitted to us. But we do have reporting from hospitals of deaths that they are seeing and reporting that we are in the process of confirming. There is again, so these are unconfirmed numbers, but just over the past week we see numbers of 56 deaths yesterday, 43 the day before, 45, 36, 43, 32, 34. So you know, a few dozen to several dozen deaths a day has been normal now for the past couple of weeks. Unfortunately, Alabama has passed the 12,000 total deaths overall, which is a very grim milestone and one we're not very happy about. I think what's most discouraging about these numbers, all of these numbers, is that because the severe illness and virtually all the deaths are occurring in unvaccinated people, we feel like this is preventable. These people did not have to die. These people did not have to be in the hospital, and vaccination would have prevented most of that. And that's extraordinarily frustrating for us. It's incredibly sad for the families, for the loved ones of these people that are no longer with us. We are seeing increasing numbers in our pediatric population. I mentioned hospitalization just a moment ago. By comparison, last year, schools were beginning last year, although certainly many of them were beginning virtually, but in the first 18 days of August last year, 2020, we had about 1,831 cases of COVID in the 5 to 17 age bracket. That was last year, 1,831. This year, in exactly the same time period, August 1st through 18th, in that same 5 to 17 age bracket, we now so far have 8,462 cases. So that's about looking at it roughly almost 4 times increase in the number of cases that we've seen as kids are getting back to school. We don't have an easy way to correlate that with who's in person and who's virtual, and certainly not every person in that age group might be in a school. Even there may be reasons that they're not. So these are not school numbers, but these are just age group numbers. And you can see that we've seen a huge spike in cases over the last year, which we attribute largely to the infectivity of the Delta variant. I mentioned a moment ago and want to reemphasize the best way to keep our schools open is to make sure that all eligible people are vaccinated, that kids mask consistently and try to maintain at least a 3-foot distance, and that when cases or close contacts are identified, those kids are removed from the classroom setting. That's the way we're going to keep kids in school. That's the way we're going to keep from having to go back to the situation that we saw last year, which we don't want to be in. At this point, we have just under 2.2 million Alabamians who received 1 or more doses. Looking at the national news media today, I think we're tied for 44th. So for once, we're not completely in last place there. There were actually about 5 or 6 states below us in terms of 1 or more doses. We still lag virtually all the country in terms of completed vaccine series. We're just under 1.7 million, but we certainly hope that number is going to improve as we see more and more people coming in now to get their first shots. There was some news that's come out over the last several days about additional doses or booster doses. I wanted to cover that with you just briefly. Remember, a week ago today, last Friday, there was information issued about additional doses for certain people who don't respond well to vaccination. So those people who are severely immunocompromised, people on chemotherapy, for example, people who are organ transplant patients, people who have untreated HIV disease, those individuals don't respond to any vaccines, including the COVID vaccine. So there's a recommendation to go ahead and give a 3rd dose to those people if they've received their first 2 doses, just in hopes of producing some immune response. Now, so that's one issue. Separate and apart from that issue, unrelated to that, is actually the issue of what we are calling booster doses. There was guidance released, or at least information released earlier this week on Tuesday, I believe, Tuesday or Wednesday, about the Fed's plans for booster doses. Booster doses would be just a normal routine additional vaccination in anyone else who needed to be vaccinated. So people that may very well have responded well to their first series, but because of waning immunity over time, a 3rd dose is going to be needed in a lot of patients. The timeline for that was set by the federal government and announced as starting sometime later in September. I think September 20th was the date. Obviously, there are a lot of things that have to happen before that can take effect. The 3rd dose, the booster dose, has to be reviewed by the VRBPAC advisory group at FDA. FDA's got to grant emergency use authorization to that. Then the ACIP that advises CDC has got to rule on that, and CDC's got to accept that recommendation. So a lot of moving parts there. If everything goes as we expect, there may well be a recommendation then that starting sometime in September, people can get a booster dose, a 3rd dose of an mRNA vaccine. A few nuances there. The recommendation is going to be for people who are at least 8 months after their 2nd shot. So if we start doing that in September, that's really only going to cover. It's only going to apply to people who got vaccinated in early February or before. Most people vaccinated since mid-February aren't going to need a booster dose right away. It also applies only to the mRNA vaccines, not J&J. We're still waiting on more information on that. We think J&J recipients are going to get a booster dose too at some point, but we just don't have that information yet. We're still waiting to hear. At the moment, the best recommendation is whichever product you got originally, whether it's Pfizer or Moderna, that's what your booster dose ought to be as well. If you don't know what you got, then certainly you could get either one. But if you know, we want you to try to get the same one. We believe now that Delta is well over 95% of the specimens that are being sequenced nationally. Here in Alabama, again, we're not always as confident with our numbers just because of the relatively small amount of genomic sequencing we're doing, but we're certainly in that ballpark. The last numbers we saw that were from Alabama had us at about 84%, I think, of all strains that were being sequenced, which were Delta. So we're certainly seeing that most of those, and I think it's no surprise that the variant that's the most easy to transmit is the one that's going to become the predominant variant. So we expect to see that number continue to climb to reflect what's happening nationally. Because our hospitals have been under such strain, we've been working on a number of plans to try to bring additional staff using federal resources. We do have a health and medical task force team supplied by HHS that's traveling today to Alabama. They're going to be deployed to South Baldwin Hospital in that area in Baldwin County. This is sort of a smaller version of the so-called DMAT teams that we've talked about before, the Disaster Management Assistance Teams, I believe is what that stands for. The medical task force that we're getting from the feds is going to include 1 physician, 2 nurse practitioners or physician assistants, 7 RNs, 1 LPN, 3 paramedics. So that team comes as a unit. The hospital will have a lot of say over how those folks are being used. Some of it will be maybe adding some additional capacity. Some of it may be replacing staff who are doing some things like, for example, monoclonal antibody infusion, so that staff can be used in the hospital for other things. But it's just a way of augmenting their capacity there. And so we're very grateful for that. We appreciate all the great work that we have had by our team here in making that happen, and all the assistance we've had from our federal partners as well. We have another team that we think may be coming soon. I'm not going to say a lot more about it yet because we just don't have confirmation of that, but in the next day or two we hope to know about a second team, hopefully, if that happens, coming to Alabama. As you can imagine, everyone in the country is asking for this kind of assistance. We also have events going on in Afghanistan, events going on in Haiti, and there are federal resources deployed related to those events as well. So there's just not a lot of extra capacity out there right now. We continue to try to emphasize to people the importance of monoclonal antibodies. If you are someone who's a close contact, or if you're someone who has become sick but not yet sick enough to be hospitalized, but you're at high risk for serious illness because of age or other health problems, then you are a candidate for monoclonal antibodies. We've seen quite an increase over the past 3 to 4 weeks in the demand for monoclonal antibodies. These are highly effective treatments that can be given to keep people from becoming hospitalized. We encourage everyone to seek those out. Right now, the best way to obtain that is through your own healthcare provider. For those folks who don't have healthcare providers, we are still working on other ways to make sure that all people have access to that. We do have a partner, a commercial partner that recommended to us by the federal government that's working on a model of an infusion clinic that we hope to have in Mobile County very soon, but it would just be a dedicated center for monoclonal antibodies. Additionally, there may be some vaccination and testing capacity there as well, but primarily it'll be designed for monoclonal antibodies. It's as you may be aware, monoclonal antibodies are mostly given by Ivey infusion, and so that means they tend to be given in places that do IVs, like hospitals. And yet, ironically, this is not a drug for someone in the hospital. In fact, it's only for outpatients. And so it has this sort of effect of taking outpatients who don't need hospital care and clogging up the hospital capacity, because that's where you go to get the treatment. And so we're doing our best to try to help our hospitals with that and trying to make sure that people can get that in other settings. We do have new guidance that I mentioned to you last week about using this drug in ways other than an IV infusion. It can also be given as a shot under the skin, or a subcutaneous injection, or a series of subcutaneous injections. That has the promise of hopefully getting it out into to ordinary medical offices or clinics or urgent cares or places where IV infusions usually aren't done. So we've worked very closely with the Medical Association on that. Our pharmacy team here has done a terrific job of trying to reach out to providers to encourage them to do that. So what we hope to do is to continue adding sites where the public will be able to access these monoclonal treatments. Again, these are for people who are at high risk for getting sick. These are tremendously effective for keeping people out of the hospital. Right now we have about 134 is the number, I think I added right, 134 sites in Alabama that have had these treatments available or continue to have these treatments available. So we certainly want to continue to broaden that. Just a couple of other items to wrap up. I want to bring up again COVID vaccination and pregnancy. This question continues to come up. That COVID vaccine is absolutely important if you are a pregnant person and otherwise eligible for the vaccine. That would be most anyone who's pregnant. These vaccines are safe in pregnancy. They do not cause problems with delivery or fertility or anything like that at all. They're not associated with stillbirths or spontaneous loss of pregnancy. They do not cause harm to the baby, and in fact protect the baby at least somewhat after being born, because maternal antibodies can be on board that baby at the time it's born to protect the baby as well. There is very strong safety data on the use of these vaccines in pregnancy, and because pregnant women are, relatively speaking, immune compromised, they tend to have worse illness than you would expect for their age when they are pregnant. We want pregnant women to seek these out and get vaccinated as soon as they're able to do that. As always, with those kind of questions, please talk to your own doctor if you have questions about that. If you wonder whether that's right for you or whether you should do that, please talk to your doctor so you can make a good decision for you and your baby. Finally, I'll say that it is getting towards the end of August. We're starting to think about flu season again, like we always do this time of year. Flu vaccines are going to be arriving soon. Please know that you can and should still get a flu shot. The flu obviously is a virus that's different from the SARS-CoV-2 that causes COVID-19. You can take those shots at the same time. When the vaccines were brand new, there was some question about when you could take other types of vaccinations and did you need to wait and separate them by days or weeks. In fact, you can take those vaccines together, and if you have the opportunity to do that, please do that. When we have a pandemic of a respiratory illness going on, like we're seeing with COVID-19, it sure is a lot simpler to know that we have people protected against flu as well, because flu cases really make it difficult to know sometimes what's going on in someone. So last year, because people were doing a great job with masking and because vaccines were becoming available to protect them against COVID as well, we really didn't see a lot of flu. We saw diminished transmission of all respiratory illnesses. So we want to continue that. We don't want to have a flu season again if we can help it. So that's all the prepared comments I had. We'll be glad to answer questions. We can start here in the room, and then we'll go to you all on the phone.
Dr.
Yeah.
Harris, you mentioned the pediatric cases earlier. How would you describe this as far as the most, would this be the most dangerous we've seen so far for children in Alabama?
Yes, it's certainly the highest number of cases we've seen. I think, again, it's the variant that's much easier to transmit. I think this time a year ago, many kids were probably not back in school or were in school virtually, and so certainly getting kids back together in large numbers, has got to play a role as well. But I think the biggest issue is just how transmissible this variant is. So we certainly have not seen numbers of hospitalized kids or kids on ventilators like this before. Yeah.
Dr. Harris, what's contributing to the increase in vaccination recently?
In the number of people getting vaccinated, yeah. I think there's probably more than one reason, but typically when we have these spikes, we do see people who just sit up and take notice, probably because they just have a personal experience with it. They know someone in their family who's been sick, or a friend, or somebody at work or at church. When you know someone personally, that probably motivates some people and gets them off the fence. I think also people are beginning to realize that we're really lagging here in Alabama. Over 200 million Americans have gotten a shot. Way over the majority of Americans have made the decision to go ahead and get vaccinated. Hopefully, people will begin to see that it's just normal and that we need to do the same thing here. Yeah.
So you were talking about.
Yeah. Let me go to the room here, and I'll go to the phone next.
Sorry, you were talking about children in school earlier. Are you concerned about this being football season and everything, and that it might potentially be super spreaders?
Yeah, football season is interesting. I think, the groups of people in outdoor activities, certainly kids on the field, we don't feel like is probably that risky necessarily. I don't think we knew that a year and a half ago when this started, but I think the chances of disease being transmitted, on the playing field seems, fairly unlikely or fairly uncommon, I guess. People gathered at outdoor events, again, should try to do that safely, space if you can do that appropriately. Masking is less important for outdoor events, but certainly if you're not vaccinated, certainly if you're somebody who's at high risk because of your age and because of other health problems, you certainly ought to consider masking. I think when you think about college football events, those are huge social events in Alabama, and so there's 100,000 people at the game, but there's 1 million people in each other's den and living room watching television, and those are really concerning. I think you really see a lot of chance for disease transmission there. So let me go to the phone there.
Yes, Dr. Harris. Obviously, through July and August, we just saw a meteoric rise in hospitalizations. The day-over-day increase over the past few days has been smaller. Is it possible that we're looking at something of a plateau, or could that be unfortunately related to rising deaths?
Yeah, that's a great question. That's one we've spent a lot of time looking at. I'll just giving you total numbers of case numbers that are reported to us. These aren't always, numbers coming to us is not the same as when the case number occurred, and we occasionally have a day like a weekend where we have 0 and then a big number the next day, so you can. You have to take it with a grain of salt a little bit, but we've had over the past few days some daily case numbers over 4,000 reported to us. The last couple of days have been in the 3,000 range. I think it's possible there could be a plateau going on. I am not confident enough to say that that's what's happening. I certainly hope it is, but as we've always said to you guys. The hospitalizations and especially the deaths are lagging indicators. Once the case numbers go down, you've still got, a couple more weeks of people in the hospital who, finally show up there. And then, 2 or 3 weeks or more sometimes of deaths occurring when you have those long hospitalizations that people unfortunately don't survive. So we hope case numbers are going down. I don't think that's, going to be a magic bullet for what's going on in our Alabama hospitals now for a little while, though. Yeah.
Dr. Harris, this is Brendan Kirby from Fox Center Mobile. I was wondering if you could talk a little bit more about this federal team headed to Baldwin County and how South Baldwin Medical Center was chosen, given that every hospital in the area down here seems to be similarly overrun, and what are the prospects for getting more federal help to the other hospitals?
Sure, I'll be glad to. I'm gonna ask Jamie Durham to come and speak with you here. He's overseeing many aspects of our COVID response, including the team that worked with the feds on this. So I'm going to turn the mic over to him.
Thank you, sir. I won't sit in your chair. All right, so that's an excellent question. What we did is we worked with the Alabama Hospital Association to see where a lot of their load was located and tried to identify those hospitals that were in the most critical need to accept some DMAT patients or these many smaller versions of DMAT. So that's how we selected South Baldwin. We are trying to get another DMAT team in the state right now. The tasker has gone up to the federal level. We are waiting for it to source personnel. And when that team comes in, it will go to another location as determined by Allahaw and Public Health as where the most critical needs are for these staff areas. Additionally, we are looking at trying to bring federal resources in for smaller hospitals. There are the National Medical EMS contracts that we have initiated. There's a 15-person package we're trying to bring in the state so we can actually give hospitals some paramedics so they can help with the Ivey treatment, because we realize treatment is the answer to help the load on the hospitals. That has been sourced all the way to FEMA, has been approved, and again, just waiting for a staff to be tasked to that mission. So those are a lot of things that are going on. A lot of this is done in collaboration with Allahaw to make sure we make the proper placement choices in the most time of need. Did I answer your question?
How long will that team, and how long will that team stay in place at South Baldwin?
That's an excellent question. So DMAT teams are normally slotted for 2 weeks. However, we will put extensions in, and then they will be backfilled.
backfilled meaning that they would move new people in to replace them?
That is correct, sir. It could be a variety of personnel. Could be could be DOD. Could be more HHS staff. So we'll be asking for that backfill.
Dr. Harris, at this point, are you giving any guidance to restaurants or bars about how to handle things like masks or any additional guidance about safety, employees, or what they're serving? Are you issuing any guidance on that at all?
I think I heard your question. Is that about guidance? You said to restaurants and bars. Was that, did I get that correct?
Yeah, like restaurants and bars, people are still going out, they're still, masking when they can, but it's up to them. So what guidance are you giving if you're issuing any?
Yeah, sure. I think we stand by the guidance that we have been giving, for months and months now. We certainly believe that in indoor public places, people need to mask wherever that's possible. Obviously, when you're eating and drinking, masking is not reasonable. But we do want them to try to maintain space between people to the extent that that's possible. The state's not imposing those restrictions on restaurants and bars, but we certainly do ask them to do the right thing and try to be responsible in protecting the public. I know there was some particular guidance put out yesterday by Dr. Mark Wilson in Jefferson County about that, talking to all businesses and asking them to encourage mask use. And I certainly applaud him for doing that. I'd support that completely. And we would have the same message for everyone else in the state as well. And again, to individuals, we want to remind individual Alabamians, we are seeing as bad a situation with COVID as we have ever seen. There's not a stay-at-home order in place. There's not any, closures of public venues in place. But if you're a senior, if you're somebody with chronic health problems, right now, even if you're vaccinated, please think twice about what you're doing. Vaccination really protects you against serious illness and death, but you still can become infected. For people who are unvaccinated, I just think you need to avoid being around people who aren't in your household and being in public spaces. It's just not a good environment for those folks right now. So, let me go here in the room.
Hospitals say that they're seeing a lot more patients in their 20s, 30s, and 40s. Is there data that shows that this wave of Delta is hitting young people harder than the initial wave? And if so, why is that?
Yeah, so the question has to do with the age distinctions with Delta and others. There's no I'm not sure if I have it with me, but there's no question that the average age of people who have been hospitalized is going down. I've seen those numbers. It's absolutely true. I don't know that it's clear that Delta is worse in that age group or worse in anyone than the strains we've seen before. We mentioned this a time or two in these meetings, but there is some suggestion maybe that it's a little more dangerous, but there's also plenty of data that shows that it's probably equally dangerous to what we've seen before. What you have, though, is one that's just much, much more transmissible, and because our seniors are the ones that are predominantly the vaccinated population in our state, the most vulnerable people are these younger people. And so you see them getting infected at much higher rates than we had before. There's just more of them getting infected in that age group. And so even if you have exactly the same degree of causing serious illness, you just end up with more people in the hospital. As the numbers go up, a certain percentage are going to be hospitalized and a certain percentage are going to die.
Dr. Harris?
Yeah.
This is Shalina Morgan with Charlotte. Can you hear me?
Yeah, go ahead.
Okay, I'm sorry. Thank you. This is Morgan with Fox 6 in Birmingham. We're seeing other states that are calling their state National Guard to assist in the staffing shortages in hospitals. Is that something that could happen here in Alabama, and are any of those conversations ongoing?
Yeah, I would say ultimately that's a decision that the governor makes, in conjunction with the National Guard themselves, and certainly in discussions with state EMA. We have been part of those discussions. We're aware that some of that's going on. I don't know. A decision has not been made on that, and I think it's probably not likely to be made immediately. But certainly that's always an option to us. The Alabama National Guard were just terrific partners, and we could not have gotten as far as we did without them. At the same time, they were activated for a year and a half, and there just aren't many National Guard missions that last that long. So that's certainly a lot of consideration's got to be given to all those factors in deciding to activate them again. But certainly that's an option that we're aware of.
Dr. Harris, I was wondering if y'all have any visibility on, some other states have talked about issues with staff actually leaving the state during the pandemic to seek more lucrative opportunities. I know that's nothing that could be. Do y'all have any visibility on whether that's happening and whether that's a concern as cases go up?
I'm sorry, I missed that one.
Like nurses leaving, go to other states because of the lucrativity.
Oh, yeah. So, yes, so I'm sorry. So travel nurses, yeah. That's an issue that all states have dealt with. We've certainly seen our share of that in Alabama as well. Healthcare professionals are just in short supply right now. The biggest issue, for example, with us getting help from our federal partners is not the lack of money or the lack of willingness to help. It's the inability to find healthcare providers who aren't already working full time somewhere else. So there is, unfortunately, always a little bit of that, going to the highest bidder element. I think. We don't have numbers on that. You say, do we have visibility on that? I would say we don't really have any data on that, but we're certainly aware of healthcare facilities that have reported that to us. And we don't begrudge anybody trying to make a living and doing what they need to do for themselves. But yeah, I think it's been a pretty difficult situation for less resourced states like Alabama, and when more resourced states can pay a lot more for the people who used to be working here. So. Yeah. Could I get you to speak up there? I'm sorry. I can't hear you very well.
Okay. Can you hear me better now?
Yeah, much better.
Okay. All right. The press release you guys put out yesterday talking about pediatric cases. What is your message, I guess, to parents over 12 and under 12 for their kids? It seemed like you were really hitting on some of those kids who are not vaccinated have immune problems after COVID. Could you talk about all of that?
Yeah, I think this. I mean, certainly there are long-term consequences that we've seen in adults too, but particularly in kids related to COVID. For kids who are eligible for vaccination, we really think most of that's preventable. I don't really have specific data on long-term COVID or long hauler syndrome or those things in vaccinated kids. It may happen. It certainly seems like it's going to be a whole lot less likely to happen. But clearly for kids who have the opportunity to be vaccinated and are not, it's particularly difficult to know about those cases when kids go on to have symptoms for months and months. I might ask Dr. Karen Landers to respond to that. I think she's on the call and is a pediatrician who might be able to give you more insight into that. Dr. Landers, are you with us? Oh, well, we may have lost her. She was there earlier, so we'll try to circle back on that. Did that answer your question? Okay.
Okay. What about for those who are not vaccinated? Is it greater potential for them to have immune problems at long haul after that if they're not vaccinated?
Yeah. Again, I'm not familiar with data that shows the rates of long haul COVID in vaccinated versus unvaccinated. I think certainly vaccinated kids are just a whole lot less likely to get infected in the first place. So the absolute numbers obviously are going to be much less in kids who are vaccinated. In terms of rates, my guess would be that they're less likely to get that, but I just don't know that information.
Okay. We see an increase in these cases, kids getting it. Is it happening in schools with school opening? Dr. Mackey said today he doesn't believe the spread is happening in schools.
Yeah, I don't think we know. I mean, kids are only in school for part of the day, right? And what you see in schools is going to be reflective of what happens in their communities. If they're in a school that's trying to distance kids and keep them in bubbles and they're wearing masks and, the staff are, vaccinated, it seems like that's a less likely place to get infected than, some of the places you might go out in public when you're not in school. But it's really hard to pinpoint that. To know exactly the place and time where somebody got infected is a lot harder to say than you might think.
Dr. Harris,
Is there any word upon the return of the Alabama K through 12 COVID dashboard?
The K through 12 task force?
COVID dashboard, school.
The case of the school.
Oh, the dashboard, I'm sorry. Yeah, I apologize, I'm just not hearing well today. Yes, so, yeah, we do expect that to be going in early September. Again, if you'll remember, that information is voluntarily reported to us by schools, and then we assemble that and display it on the dashboard. And so it's really completely relying on the school's ability to report that information. We know that a lot of schools are continuing to do what they've done before in their own districts. They're, noting cases, and of course they give us that information one at a time individually when they have a case that they know about and report. And then they tend to, the ones who are doing it tend to continue reporting that information to parents and people in their communities. But the actual process of putting it into the dashboard that they worked with us on last year is just something that a lot of them haven't gotten back to doing yet, because school's just beginning, and that's just a lot of additional responsibility falling on those school nurses responsible for that. But we do expect to have that back, pretty soon, in September is what we think. So.
Dr. Harris, following
Yeah.
up on that question about football season starting, last year you had empty stadiums for the most part. I don't think that's the expectation this year. What's the best policy for football fans, and how much of a concern is that about adding to this surge that we're having now?
Yeah, we've had a lot of discussions with people around this in high schools and in colleges. Again, our guidance is the same. Our guidance hasn't changed this year from last year. I guess when the football season started last year, there was a health order in place, and so that, caused some things to happen that might not have happened. But our guidance is really the same. People need to try to be spaced apart. And if you can't safely do that, especially if you're somebody who's highly vulnerable, I wouldn't recommend going. If again, outdoor events are, safer in general than indoor events. But, having, hundreds of thousands of people getting together at a time during a pandemic is going to result in some disease transmission. We hope people are vaccinated enough that can be minimized. But, with really large-scale outbreaks going on, you wonder how long those stadiums are going to stay full. Yeah, let me go here in the room, and I'll go to the phone next.
Dr. Harris, I know the White House vaccination coordinator was here this week. Let's talk about how that visit was with you and the White House vaccination coordinator.
Sure. We had a terrific visit yesterday. I had two different fairly long meetings yesterday with Dr. Bachara Shukar, who's the White House vaccine coordinator. Dr. Shukar is well known to people in public health. He was the Chicago Health Commissioner for several years, actually, before he took another job with Kaiser, and now he works at the White House. But we met yesterday with him and with members of the governor's staff, and just to get an update on what's going on in Washington, what we can expect in terms of timelines around vaccines, ideas about how to address hesitancy, ways to reach out and sort of maximize what our providers are able to do. It was just a really good conversation. I know he's had other meetings with hospital groups and with some of our federally qualified health centers. I also had a chance to be part of a meeting with him last night, talking to Alabama physicians that the Medical Association sponsored, and it was a lot of really good questions about, again, vaccine strategy and just way to get that out, and there was a lot of particular discussion around rural areas and sort of the challenges of doing that in rural areas. So it was actually a terrific visit. He's been a really good partner for us. We've talked a lot during the past 7 or 8 months, and so we were very glad he was here. We go to the phone there now.
Dr. I have a question regarding data. On the hospitalization data, is it possible that we might be seeing a delay there with hospitals sort of being stretched so thin that there are folks waiting to be admitted? I just didn't know if that was a possibility.
I guess I probably haven't. I don't see the primary data directly. We get that information reported to us from the hospitals, but it's reported daily, and I believe they have literally every hospital in the state who's agreed to report that information daily. So I don't think there's any delay in that. I suppose it's possible, but once a person's in the hospital and the decision's been made to be admitted, they count, you know, even if they're still sitting in the emergency department. So I don't believe, or I should say, I do believe we're getting the very best data we can there.
Dr. Harris, this is Morgan with Fox 6 again. I wonder, I know earlier in the pandemic y'all did a study to try to see why people were hesitant to get the vaccine. Has ADPH done any more research to kind of figure out what is the holdup now for people this far in the pandemic?
Yeah, well, we certainly had. We've done some additional community assessments, sort of rapid community assessments in some other counties. We originally had CDC folks from Atlanta come and help us in some of our counties. We had we have CDC staff assigned here who's continuing to do that work in some additional counties. We've also worked with, you know, one of our communications team that had done a lot of polling around that, and then we still have, you know, access to other data that's being done by media outlets. You know, there's again, you know, this is the same answer we probably gave 3 months ago, but vaccine hesitancy is really complicated and it's really different from person to person. There's a lot of different reasons people are hesitant. A lot of those reasons are really smart, good reasons, and people just haven't gotten answers that you know, other people have gotten answers to. Sometimes the decisions are, you know, don't make as much sense to us, you know, who see the facts and work in healthcare and understanding what's going on, but you know, everybody gets their information from different sources, and sometimes it's hard to reach everyone. I would say that, you know, what's happened in the past month has really shown that there's a lot of people out there that can still be moved. I mean, you know, the people who have been coming in at the rate of, you know, 15,000 a day for the past 2 or 3 weeks, these weren't hardcore, never going to get vaccinated people, right? I mean, obviously they weren't. Because they are all coming in now. So I think there's, just like everything we do in life, I think sometimes there's just inertia that has to be overcome, and until you're motivated to get out and do something, sometimes you just get busy and you do something else. So I'm actually encouraged by the numbers we have. You know, it is a urgent situation, though. It's a race against time, and as we've told you before, the people who get vaccinated today, you know, start their series today, really aren't going to, Alabama's not really going to see the benefit of that for 5 or 6 or 7 weeks, because they've got to get a second vaccine, and then they need a couple more weeks for full immunity. So we really need people to hurry up. I mean, the rush is that our hospitals are underwater right now. We're continuing to see these high case numbers. You know, any person who becomes infected could be the one who creates the next variant that the vaccines don't work very well for. Or that creates the next variant that's much more deadly than what we've seen before. So it's really an urgent situation. We do not have any time to waste on getting people vaccinated.
Dr. Harris, this is Brendan again from... Is that okay? Sorry, let me just do one more question for you, Dr. Harris. When you were, you know, reading through the list of numbers at the beginning of your statement, and you're looking at everything that's happening in the state right now, the children getting sick, you just in a news release that said they have an alarming number of pregnant women in the ICU with this virus, the vaccine hesitancy, the staffing shortages that we're seeing in hospitals across the state. What to you right now is the most concerning thing or the greatest obstacle that the state is facing?
Well, I mean, the most concerning thing is that we don't know how long we're going to be able to maintain our healthcare capacity. You know, I think, you know, since the very beginning, you know, a year and a half ago, we've had these 3 goals that, you know, sort of guide what we do, which is to prevent people from getting sick and dying, to protect our healthcare capacity, and then just to communicate effectively to the public. So we try to remember those 3 things in everything that we do. The second one I mentioned, protecting our healthcare capacity, that's really tenuous right now. You know, we are pulling every lever and pushing every button and using every resource we can think of to try to do that. And, you know, at some point, there's just physically, you know, not enough room to take care of all the sick people in Alabama that we might see if we don't get more people vaccinated. So that's clearly, in my mind, the thing that worries me the most.
Dr. Harris, Brendan from Fox 10 again. I want to go back to the booster shots. The Deputy Director of the CDC last month had expressed concern that a 3rd shot might bring more severe side effects. Is that a concern to you? And assuming this does get implemented, does that mean that fully vaccinated is not going to count until 14 days after your third shot for purposes of keeping track of breakthrough infections?
Yeah, so I would say that was a smart question to raise, but the truth is we just don't know yet, and that's the reason we have the process that we have. There's an advisory group to FDA called the VRPAC that reviews all this and makes a recommendation about whether to authorize or approve something, and then that goes to the ACIP, who will, again, make decisions on how those products should be used and recommend that to CDC, who makes a recommendation to us in public health and other health practitioners. So there's still a lot of steps to go. I would say I am unaware of any data that shows that there are worse side effects with a third injection. There might be, I don't know, but I've never heard that issue raised before except as a theoretical concern. And in terms of knowing what we're going to call fully vaccinated again, that's part of this process. That ultimately there'll have to be a timetable that everyone agrees on once they've looked at the data, and it might be 2 weeks after the third shot, but it might be a week after the third shot. Given that the people who receive 2 shots are fully vaccinated at some point, it may even be that they just remain fully vaccinated even though they're in need of a booster shot, just by definition. So I think we've just got to wait till everybody agrees on what those definitions are. Yeah, here in the room.
Dr. Harris, this one.
Let me go here in the room first.
Back to football, which I apologize can be more controversial than politics. Have you specifically recommended to universities and high schools to limit stadium occupancy and take other prophylactic steps, or is it just the recommendation that's spaced out and set?
Yeah, I have not specifically given them recommendations on that. What we have told them are the same things we've said all along. We think that this is the best way you keep people safe, and spacing is part of that. Clearly, masks, in some situations are part of that. Emphasizing vaccination is probably the most important part of that, but we've not given them specific instructions on capacity. Yeah, back to the phone there.
Okay. Dr. Harris, just for clarification, when you were going over the numbers, dealing with death, on the dashboard, the department has it of 11,942, but you mentioned we were over 12,000, or did you say we were close to 12,000?
Let's see. Let me tell you real quick, Ellen. I believe that at least the preliminary numbers I know were over 12,000. I believe officially we're still just under that. So we have some more reported to us that put us over that number that are in the process of being confirmed. So it would be great if they're not confirmed. I hope they're not, but I believe we're going to ultimately be over 12,000.
Dr. Harris, regarding the federal aid, can you sort of expand? Did the state put in a specific request for a certain amount of federal aid, or like a certain number of teams, or something like that?
Sure. I'm gonna ask Mr. Jamie Durham to address that again. He's the one who oversaw that process.
So that's a great question. So what we do is our locals submit a form to us called the essential elements of information. We in turn send that to HHS, and we do some DMAT assessments. So we get on phones with calls with hospitals to coordinate and talk about what their needs are, where their shortfalls are, the gaps that they identify, and then we give recommendations of the number of nurses or doctors that we need in the state. So what we do is we elevate what we think our number is. So for example, I said a state essential elements of information, and it was something like recommending almost 200 ICU nurses that we need in the state of Alabama. So we try to give the federal government a good sense of what our needs are in the state of Alabama based off assessment teams that we talk with and coordinate with CEOs of hospitals, so they can see the magnitude of the ask. And so that's what they do. They look at the magnitude of ask, but they look at that across the board nationally, and you realize they're not unlimited resources that they can send us. So that's the process. Did that answer your question?
Yeah, so you said about 200 ICU nurses. Do you have any other numbers on what you all requested?
So yeah, I do have those. I don't have those numbers memorized, but we requested a number of doctors, paramedics, EMTs, ICU nurses, med-surg nurses, regular nurses. So there's a very large number that we requested, and I give that to Ryan, and I can let him share what we as a state have requested based off assessing 8 hospitals, which we have done so far to date.
Okay, and then so far you're gonna have one team come to the Baldwin County Hospital, and you guys listed those numbers earlier, and then you're hoping for another team.
Yes, ma'am. Plus the additional 15 paramedic strike force we're hoping to get in the state also. All of these requests have been vetted through FEMA, and they concur. Now it's just sourcing it, trying to find the people, the bodies. So it's like faces to spaces, for lack of a better word, it's like faces to spaces. Can we put those faces in those spaces that you're requiring? Does that make sense?
I think so, yeah. And can you tell me your name again?
My name is Jamie Durham.
Okay, thank you.
Oh, my pleasure.
And Mr. Durham, if I could just follow up real quick, when will those boots on the ground get there?
Okay, so as of right now, I do know the commander of the strike team is at Baldwin County, and a lot of their team are moving today. They should be in place later today, and then they've got to go through the credentialing process, work through the hospital to go through all of their requirements, and then they'll be ready to activate or begin their treatment process, whatever the hospital determines the need is at that point in time. But they are moving today.
Okay, thanks.
Thank you. All right. Anything? Yeah, one more here.
I apologize if this was covered. Alabama got a lot of attention this week for its net negative in ICU beds. How close is the state to a breaking point on that? And I guess more importantly, what does it mean for, you know, the person who's having a heart attack or a car accident?
Sure. So we mentioned that briefly, but the net negative number, you know, is a statewide number. It is, you know, regionally, it's not equally distributed regionally, right? And so the biggest crush of patients we're seeing now is in the southern part of the state, so kind of from Mobile to Dothan across the bottom part of the state. So those places are really, really short of ICU beds. They have critically ill patients who are in the hospital being taken care of, but they may not be in an official ICU bed. And so there are some beds available in other parts of the state. You know, typically kind of single-digit numbers. You know, even the overall total for the state is probably a single-digit number or maybe barely a double-digit number. So there is a little bit of capacity in some parts of the state. There are a handful of things that are just kept open, period. For example, you know, if there are, you know, an organ transplant patient who's about to need an ICU bed, and you know you have an organ donor, and that can't be delayed. You can't put that off. There may be a bed or two here or there that are just held open that are not going to be filled with a COVID patient because you already have that, you know, designated for somebody else. But the total number of beds available again is I think probably single digits. And so if you have an automobile accident and you know you have a 3 or 4 car pile up with 6 or 8 injured people, you know it's going to be really difficult to get all those people in ICU beds. Certainly in the same city, it's going to be really difficult to do that. Okay.
Dr. Harris, this is Liz Hurley in Huntsville. How are you?
Good. Hi.
Hey, listen, I've got a question. We have so many vocal anti-mask parents in North Alabama. School systems have reacted. Some have continued to say mask optional. Some have said mask mandatory. This after school started. You now have more kids hospitalized with COVID in the last, week or so than you did in the first 18 months. And more young adults, more middle-aged people. You have county health officers who are mandating masks. You have school boards who are mandating masks. What is preventing you, as the state health officer in a pandemic, from mandating masks again, even if the term limited time?
Yeah, Liz, as you know, it's an incredibly partisan, divisive issue. You know, Alabamians don't agree on this. We went through a mask mandate that lasted 9 months or more. We were really the only deep South red state that did that. But at this time, I think the governor feels very, very clear that this needs to be a local decision made by local officials and not something that's mandated by the state. I think, again, it seems like everybody thinks it would be some easy solution if I just, ordered everybody to do something. But I think when you have a mandate that people don't support and don't believe in, I'm not really convinced that would be a very effective mandate anyway. If people are just going to flaunt it because they don't agree with it, it's just it's not reasonable to think that I can just order it and that's what's going to make it happen. So these are decisions that are being made locally. For all the imperfections of that system, that's probably the best way to do it. You have local support or opposition, or at least local dialogue over the best way to do these things. People feel very passionately about everything related to COVID, but particularly about things that involve their kids. That's a situation that we find ourselves in. I think you can look at states where it's done differently, but that seems to be the way people in Alabama prefer to handle that situation.
So you're basically saying that it's a matter of politics and not practical medicine.
A matter of what? Say that again. I'm sorry.
You're saying it's a matter of politics and not practical medicine as a physician.
Well, I would say, just as we've said, many times before, you can only do so much public health as the public allows you to do. I mean, public health is composed of public and health, and we can, talk about health all day long, but ultimately the public's got to agree with us and to do what we are telling them that we want to do.
If I can follow up on the number of South Alabama said that they are really in a crushed situation. I talked to the head of Hempstead, which is the largest ambulance provider in North Alabama. The quote was, "We're underwater and our mouth is not even close to the water line." Tell me about the second and third areas of the state that are in this crushed kind of situation, and how many paramedics could come in and help with that influx, help with those infusions, and help with the wall waiting, as you said.
Yeah. In terms of EMS, I mean, EMS really is having a difficult time in many parts of the state. Our highest case numbers are in the southern part of the state, but we have high case numbers in every part of the state. Just like all medical care is sort of centralized into 5 or 6 cities in Alabama. That's where the COVID patients are tending to go as well. So. After the hospitals in Mobile and in Dothan, we certainly have, the highest numbers of cases in places like Birmingham and Huntsville. So there's really nothing new about that phenomenon. EMS in particular, you have to remember, even in pre-COVID times, is pretty strained in some parts of our state. We don't have tremendous amounts of resources in many parts of our state. It's not unusual for counties in Alabama to have a single ambulance service with a single ambulance. Literally one vehicle is not unusual in some of our counties. And when you're transporting a patient 2 or 3 hours away to another medical center, it's not unusual for a county to be without service. And so we really have to scramble when there's truly an emergency there. We have heard from some EMS services that are having COVID infections among their own crew, which limits their ability to respond. And we've had to ask a lot of other services to help pitch in and cooperate to provide some coverage and help, which they thankfully have done so far. But yeah, I didn't mean to leave out the rest of the state when I was talking about what was going on in the southern part of the state. The whole state is really feeling it right now. Okay. Any other questions?
Yes, Dr. Harris. Based on the data, what is there an option for the ADPH to recommend, or that schools consider virtual learning as an option at this sensational time?
Yeah, I mean, ultimately, I don't think it's our place to tell educators how to do that. We, again, are trying our best to communicate to them how to keep schools open. I think just about everybody agrees that, in-person, face-to-face learning is the preferred way of educating our kids. And there's so many, not only health consequences, but as we've said here before, but mental health consequences and social consequences and all these other things that can be casualties of moving to a virtual environment. So we, again, try to give our best advice and information to these local school boards and local superintendents. They obviously work very closely with the State Department of Education, and ultimately they're the ones that are going to make those kind of decisions. All right. Any more questions? Okay. Thank you all for joining us. We appreciate it. Take care.